What kind of symptoms would a patient be feeling that would need shockwave therapy?
The ideal candidate for shockwave therapy, or ESWT, exhibits symptoms of plantar fasciitis or heel spur syndrome. These include pain when you step out of bed in the morning. That first step of the day is excruciatingly painful that you don't even want to put your heels down on the floor. It may or may not loosen up after walking for about 10-15 minutes. The longer you're on your feet at a standing or walking job on hard floors, you experience pain in the back of your heel. Or if you've been on your feet all day, you sit down to have your dinner or drive home in the car, and you get out and your heels are killing you. These are the typical symptoms of plantar fasciitis. And also Achilles tendonitis, which is a similar thing. It's a tendon in the back of the heel, up the back of the leg, and the plantar fascia runs on the bottom of the foot from the heel.
So how does one treat plantar fasciitis?
The typical treatments for plantar fasciitis are cortisone injections, arch support, physical therapy, icing, stretching. However, if you've tried all those and they have not worked, and this is continued on for months, the ideal treatment and a great alternative to surgery, which I don't recommend, is ESWT, or extracorporeal shockwave therapy.
Can you explain what shockwave therapy is?
With the shockwave procedure, we're going to try and make you as comfortable as possible. It's going to take some time after we've numbed you up to allow that Novocaine to set in. The procedure itself has its own analgesic property to it, but first we're going to lay you down. We're going to place your foot on the bubble, get some ultrasound images, kind of like a baby picture. We're going to be able to see right within your foot there. And once we get those images, we get it put right where we want. We're going to start the process, and once we start the machine, it basically takes about 18 minutes for it to run its cycle. We're going to build up in its intensity. It's going to move a little bit faster each time. You'll hear the shock waves, and they're going to tap a little bit faster, but all in all, it'll take about 18 minutes for it to finish its cycle. May feel like a little bit of a rubber band snap, but other than that, the worst part should be over.
And are the results permanent?
They may be permanent. If you can figure out what activity, what pair of shoes started the plantar fasciitis, as long as you don't repeat that, and you've learned to notice the symptoms when they start so that we can nip them in the bud, you can be pain-free for a long time. In many patients are going on 9 to 11 years of pain-free after their shockwave therapy.
And then how many treatments should one get to achieve the ultimate results?
It only takes one treatment.